Good morning, everybody. My name's Fred Gallo, and I am the author of this, The Tapping Toolbox, which is my ninth book, and we're going to talk a little bit about it. But first, I just want to go a little bit into my history. I've been a clinical psychologist since, I guess, license-wise from 1977, and I'm in private practice. And I was always interested in human behavior ever since I was a kid. And I started to explore different approaches to therapy. I studied like client-centered therapy, behavior therapy, rational emotive therapy, NLP. And for a while, I went around and I trained people in NLP and Ericksonian hypnosis. And then I got kind of bored. I got bored with things. And here I'm in my private practice. And one day, I read an article where this guy, he talked about treating addiction. And I had worked a lot with addiction over the years. And he said that addiction was a sign of the person having anxiety. And I could agree with that. I could see the addictive urge as being a function of anxiety. And he said it was related to a bodily energy system. And I thought at first maybe he meant, just simply, neurons firing, that sort of thing. And that could make sense to me. And then he said I felt at the time preposterous thing. He said, and the solution is to have the person tap. And I thought, tap, what does he mean by that? And so then I find out he's saying you have them tap under their eyes and tap under their arms. And so I tapped those locations myself, and then I thought, God, what's going on with this guy? And I found out that he had worked with phobias, and that he lived in California. And so I imagined, it was just sort of like a weird thought in my mind, that he had tried to help people, and he wasn't very successful. And eventually, he kind of lost it. And then he came up with this idea that the solution to curing psychological problems, especially the phobias that he was working with, was to have people tap. Now, then I imagined that here this guy, he had long hair and a beard, and he was disheveled, and he lived in a broken down hovel somewhere in the desert, because I understood he lived in the desert. So anyway, I put this article away, realizing that, this seemed really ridiculous. Well, anyway, a couple weeks later, or I don't know, 2 weeks later, 3 weeks later, a client was in to see me who had an addiction problem. She was addicted to pain medication. And I was doing my standard gig. And then at one point, I asked her what it was like to have this addictive urge. And she started describing it. And as she described her urge for these pills, you could visibly see the change in her. She had a coloration change, a little bit of a tremor. And I asked her, I said, on a scale of 0 to 10, how much of an urge do you have? And she said, oh, it's a 10 for sure. And so then I took her through a behavioral technique, a cognitive behavioral technique called rational emotive imagery. And so as I took her through, basically what it involved is changing the way you're picturing things in your head and the way you're talking about it, with the assumption that if you change that, it's going to change the way you feel. And of course, that worked. And then after it brought the urge down, I asked her if she could bring it back, and she could bring it back again. And then we did it again. And every time she could bring her urge back. And of course, that didn't seem out of the ordinary to me. Of course, she could bring it back. However, then I remembered this preposterous article from the totally insane psychologist from California. And then I told her, I said, this is going to seem silly, but I read this article recently, and this guy talks about tapping as a way to deal with addictive urges. Would you be willing to try it? And she was willing. So then I had her pay attention to the urge again, which she did. And then I had her just simply do this: tap under your eyes and tap under your arm. And I had her go back and forth between that. That's all I knew at the time. And the urge came right down. And then I asked her to see if she could get it back. Well, the interesting thing was she could get it back, but she could only get it back up to a 4. She couldn't get it back up to a 10. No matter how much she tried, no matter how much I coached her, it stayed at a 4. So we did more of this tapping, but each time it could come back up to a 4. And so I was impressed, and she was impressed. And so I figured, I gotta learn more about this. And so I reached out to the psychologist out in California. And I found out he didn't live in a disheveled, hovel. And he wasn't disheveled, or a dilapidated hovel, I should say. And he did have a beard, but it was a well-kept beard. His name was Dr. Roger Callahan. And so I spent time with him. And actually, I got so interested in it, I started to write some articles about it. And then I started traveling around with his blessing, teaching elements of this. Eventually, I wrote a book called Energy Psychology. And I'll just show you. I don't have the book with me, but this was the cover. And I wrote that in 1998. And then I started getting invitations to come to Europe, to Africa, to the Pacific, the rim over there, like in Fiji and other places throughout I had traveled throughout the United States and Canada. Anyway, so as it goes on, I got invited to write that book, and then I got invited to write more and more books. And then this wonderful company called Pesci invited me to write this book, The Tapping Toolbox, which distills a lot of the elements of how to do tapping. And we're going to get into some questions in a bit, but I want to emphasize that even though the technique really, it's a technique nested within what I call energy psychology. And there's other techniques that are involved there as well. And sometimes you get instantaneous results with this. And other times, you got to be realistic. It can take time if a person has a really severe condition. Now, like with single incident trauma, very often I found that we can resolve a trauma within a matter of a session or a few sessions. If people have very chronic traumas that go back to childhood, where they didn't have much support in their childhood, it can take a lot longer. But the interesting thing about tapping is when it works for a person, nothing works for everyone. Matter of fact, I remember Roger Callahan telling me at one point, if somebody tells you that their approach works for everyone, they're either lying or they haven't seen enough clients. And that's the case, because human beings are miraculously complex and diverse, okay? And however, I find that, and there's research to support it too, that tapping is very effective as a part of an overall treatment modality. I like to combine it with other things. one of the most important things is to have rapport with your client. Or if you're treating yourself, if it's self help work, you have to have a rapport with yourself. Anyway, I want to open this up to some questions. I could go on for maybe hours about this, which I often do because I've gone around training people. But let's see some questions that people are interested in. Now, let's see. First question says, where should I start with clients whose progress is stalling in therapy? Okay, one of the most important things is rapport. So I'd say that's job number one and job throughout the course of the therapy. Now, I have a little model that I describe in the tapping toolbox, and I call it the Relita model. So, and that applies to this. So you're having rapport with the person, and then you ask them questions. You ask them, why are you here? What can I do for you? You try to get them to be as specific as possible as to what they want to achieve, and that goes along with any kind of a treatment plan. And then you listen. Your job is to really listen, and you listen with nothing on your mind, so to speak. Okay, you sort of listen in the way you would listen to music, the way you would listen to a stream. And then what you do is, as you're listening and asking these questions, something occurs to you. It occurs to you about what the client's block is, what's the missing link. And then what you do is, at some point, you ask some more questions, and then you check it out with the client. And then what you do is, it occurs to you that you can offer this to the client, and you might offer whatever your therapeutic approach is, but you might, in my case, you might offer some tapping. And now let's say if it works, beautiful, you'll see the change in the client. If it doesn't work, you do an adjustment. And that's one of the things that I emphasize in the book, the tapping toolbox, is that you have different ways you can go about doing this sort of thing so that you hit the mark, so you help the person achieve the change that they're wanting to achieve. If a person's progress stalls and you've tried different things, I think one of the best things is to ask the question, what do you think? And I notice we've been doing this and things seem to be stalling. And I'm sure you notice that. I notice that. What do you think that's about? And you do that in a way that you maintain rapport still. And you listen again. And it occurs to you, that there's a kind of a resistance that the client's experiencing. We call that, in energy psychology, we call that a psychological reversal. In other systems, you can call it resistance. You could call it a psychological block. And it can show up in different ways. Sometimes a person can feel that they don't deserve to get over the problem altogether, or that it's not possible to get over the problem altogether, or that the problem is a part of their identity, and to get over the problem, they would lose that part of their identity. Or it's or maybe I'm calling it a problem, the condition that they're experiencing, they might feel at some level that they have to have the problem, otherwise they're not being loyal to their family of origin or something. Okay, so now we have a simple little way of dealing with that. If we find that, and there's different ways to find those reversals. And we call it reversal because it's like you're going in the opposite direction of the way you say you want to go. So, and the client wants to improve, but there's this unconscious factor, which is a disrupted energy of sorts that prevents the movement. So one of the techniques, and it's going to look a little weird, is you have them say, let's say the thing is they feel that it's not possible to get over the problem. So then you have them do something like this. You have them tap the side of their hand, and they say, even though it isn't possible for me to get over this problem, I accept myself and I'm open to a miracle, or I choose to get over the problem anyway. Even and in the problem, I'm saying problem in the generic, but it could be specific. You could specify, even though I have this, even though it's not possible for me to get over this anxiety, I accept myself and I choose to feel calmer. Even though it's not possible for me to get over this depression, I accept myself and I choose to get over it anyway. And then what you do is you take them through specific tapping techniques. And maybe one of the ones that I developed, I call it the midline technique. You have the person tap the back of their head, and they can be saying, this problem or this depression, top of the head, they say the same thing, forehead, same thing, under nose, under bottom lip, center of the chest. Now, each of these are points that seem to be very effective in changing the emotional response. So that's a bit about how to go along, how to deal with this stalling in therapy. I have another question. Okay, what do you feel about EMDR? Oh, I studied EMDR with Francine Shapiro back in 1993 and 1994, and I think it's a very effective approach. I tend to think of it as a kind of an energetic approach too. Now, when I say energetic, it's you're doing something to activate the body, enlist the body with your cognitive components too. So I found EMDR to be very effective. The only thing is sometimes you got to be very, very skilled with EMDR. I found that once you get things moving, whatever way you do it, whether you have the person tune in moving their eyes or bilateral tapping or bilateral sounds, it can start things moving in a way that people can abreact later. However, once in a while, I get somebody coming in and ask specifically for EMDR. I've had people that don't want to tap, okay? And I said, well, we don't have to tap. There are other options. And so I would certainly use EMDR too. Now, I've worked with a lot of trainers, EMDR trainers, who wanted to learn about tapping too, and they integrated tapping with EMDR. So sometimes if the person started to abreact, then they would throw in tapping and they would help to settle that out. Or they would pull up the problem in more detail with EMDR, and then sometimes they would use tapping instead of just simply continuing to go with the EMDR protocol. Next question. What's a simple way to explain to my client how tapping works? Okay, well, when you tap, simple way, there's a lot of different explanations. The basic explanation is that when you have a psychological problem and there's an emotional component to it, okay, so it's fueled by emotion, that emotion is fundamentally has fundamentally an energetic marker to it, which Callahan called a perturbation. What you're doing by tapping is you're collapsing that perturbation. I know this doesn't sound simple, but there's a kind of cascade effect. It is a cascade effect. It starts off with this energetic marker that disrupts the energy system, which disrupts the chemistry, the neurologic components, the amygdala, the dorsal branch of the vagus nerve, whatever's involved in the specific problem. and also the cognitive part. So that's a more involved explanation. A simpler one, some people think all it does is distracts. Well, it does distract in a way because you know the old joke about walking and chewing gum at the same time. Whenever you bring in a problem, then at the same time you're tapping, you decrease the amount of attention you can give to stir up the emotion. So I think that starts to settle down the emotional factors involved in the problem. You also, I think there's a mindfulness component to it too, because while you're tapping, since it causes you to step back and observe more, and that helps to release it more. I hope that helps. That's another, we could go into more detail, but that covers a lot of it. Can I have the next question? Is there anything you would tell your early career self if you could go back in time? I would say, hey, Fred, it's going to get better and better. Keep the faith and stay motivated. You know, I never imagined that someday I would stumble on an approach that could literally help me to tap into what I've learned all along the way, that it integrates many things. You know, you can't just say, well, none of this other stuff matters. Only thing that matters is tapping. You got to bring in an entire therapeutic approach, or an entire, if you're treating yourself, an entire self treatment approach. And I would tell my younger self, my younger, earlier career self, that you know, good things are coming. Just believe. You know, Henry Ford said, "If you think you can or you think you can't, you're right." Okay, so believing that things are going to get better, that things are going to happen, I think that stirs you on and helps you to be motivated. Next question. Do I need specific training or credentials in tapping to use it? Well, of course, I know you can go out there on the internet and you can read, you can watch YouTube channels. There's a lot on Facebook and so on. You know, I would say if you're really going to do this responsibly, you ought to get some training. PESI offers training. ACEP, the Association for Comprehensive Energy Psychology, they offer training. There's, what are some of the other companies that offer? There's AMET, which is EFT International. It's out of the UK. There's the EFT Universe. I offer certification training that I've done all over Europe and the United States and Canada. It's on advanced energy psychology, or EDXTM. EFT Universe, if I didn't mention that already. So I think there's more to tapping than meets the eye. And so it's, if you're a professional and you really want to do this right, you want to really do it ethically, you want to do it in a sense legally, because if you don't have proper training, you're not going to offer the best to your clients. And so I think it's important to do that. Is there another question? Now, I think we're at the end, my friends. I want to thank you. I want to thank you for showing up here today. I want to thank PESI, a remarkable publication and training organization. And I wish you all well, and get out there and tap into wellness.